Facial capillaries is a very common presentation amongst Australians. It occurs in the spectrum of facial capillary redness and rosacea. The underlying redness is a result of broken capillaries that gives the face a reddish appearance. The spectrum of rosacea becomes a medical problem when one also gets little pimples, pustules, and also eye irritation that can accompany the problem. Patients seek help with rosacea when they have either symptoms such as facial redness, flushing, the discomfort associated with precipitating events such as spicy food, hot temperature, making the face flushed and uncomfortable. The second reason is patients presenting concern about the appearance, which makes them feel embarrassed, particularly in the social situation. Finally, the rosacea spectrum can also cause thickening of the skin, particularly in men and on the nose. In the management of facial redness or rosacea, the specific therapy really depends on the presentation. If the presentation is just redness or broken capillaries, then one can use a vascular laser to zap away the capillaries. This is effective and it requires generally in the order of 2 to 3 treatment sessions to clean up the facial capillaries. People with the rosacea spectrum may also have inflammatory lumps and little pustules, and these may require either creams or oral anti-inflammatory antibiotics. These can be prescribed by your doctor. Finally, patients with thickening of the skin, particularly the rhinophyma or the lumpy nose syndrome, these patients may require resurfacing. So in terms of treating the capillaries, there is a range of lasers we can pick from. The principal use of laser is to deliver a light energy that will target the color red, which is found in the red blood cells, the hemoglobin. The laser gets converted into heat, the laser light energy gets converted into heat, and this will destroy the targeted capillaries. So in terms of the types of devices, the common laser device would be the pulse dye laser. There is also the 532 and 1064 type lasers. These are terms given to the wavelength that the laser energy is classified as. There is also a separate group of energy devices called IPL, which provides a broad spectrum of light energy to target red, as in capillaries, and also a little bit of brown, as in pigment. So sometimes, in instances, the combination of the IPL and one of the listed vascular lasers can be a very effective method of controlling telangiectasias or broken capillaries of the face. The laser delivers a high energy light, which can often be felt as a zapping sensation. It is very well tolerated, but some patients who are sensitive may benefit from a forced chilled air convection blown under the skin. Perhaps a little bit of cream anesthetic may be helpful, and occasionally the nitrous oxide gas is also used in patients who are a little bit anxious. But by and large, the devices are well tolerated and do not need any of these pain controlling agents. In my experience, I tend to prefer a combination of devices to get the best possible outcome. And depending on the severity of the blood vessels, the treatment can be phased generally 2 to 3 treatment sessions, usually about a month apart.